Tēnā koutou katoa, ko Sarah Cullum tōku ingoa. So I, as you can probably tell, I'm from the UK originally. I moved here 8 years ago, and my background was old age psychiatry, but also dementia epidemiology. So when I first moved here, I realized there hadn't been very much done in prevalence of dementia, and we've done a lot of work around that. And we've now got this HRC program grant where we're going to be able to do a national study. Meanwhile, one of the reasons that we didn't get a grant for some time is it's really expensive to do community studies. So we started looking at the routinely collected data, InterRAI being some of the routinely collected data, because obviously this is fairly standardized collection, maybe not research standard, but we could still look at it and see whether we can look at risk factors for dementia and so on. But to do this, you need some clever people like Cristian and computer science. So I worked with Jill Dobby on some grant applications. She's a professor of computer science at University of Auckland. And we eventually got an HRC project grant to look at some data in counties Manukau. So just very quickly, we've already talked about this study. This is Gary's study where he looked at 7 national data sets and was able to start looking at New Zealand data to see, what the prevalence of dementia was. So that was a first step. At the same time, we were looking at Counties Manukau data, and this is a local memory service. It's the biggest memory service in New Zealand. And we were able to look at things like Maori and Pacific Islanders presenting at a younger age with dementia, the kind of utilisation of services. We found out that Maori and Pacific Islanders are much less likely to use care homes, but they don't get a compensatory increase in home-based support services, and there are lots of reasons for that. We looked at mortality, and this was all by just linking data that was in Counties Manukau, kept within the county's environment, so safe. But then we thought, well, can we start looking at bigger data sets, not just the memory service? And that was the basis really of Cristian's PhD. So he's going to talk about what he's been doing and how he's going to use machine learning on a much bigger data set.
Thank you, Sarah. Kia ora. So happy to be here in Wellington. It's my first time here, beautiful city. So as Sarah mentioned, I'm going to talk about my project, my PhD project. And what I have done and what I have to do to finish it. So basically is we have routinely collecting data from Counties Manukau in a different databases, and we want to use that data to predict dementia in the time. So what it means, like we have the diagnosis of dementia and we want to get all the data before of the diagnosis and use one of the machine learning models. Later I'm going to talk about that. And the idea is use that model and get at least one risk value to tell us in the time what is the risk of every patient to get dementia. So in that case, we can make an interview in the time before and delay all the outcomes that dementia has. So basically, that's the aim of my PhD project. Is basically this develop a machine learning model that may able to predict dementia in the time. And this is taking in account also attitudes and preference of people, because as the data is already collected, we don't have like a consent to use the data. So this aim, actually we divided in 4 stages for my project. So the phase 1 is basically talking about the ethics and how we are going to use the data, how people feel about that we are using the data for research. The second phase is all the process of getting the data and pre-processing of the data, which is a really hard work because every data has in different formats and everything. Then is the development of the machine learning model. So the problem here is, like, as you know, machine learning models are known to be like a black box. So the idea of this project is try to make it a little bit understandable for people that know the computing science this. And the final phase is just talking about the dissemination to the community, all the results that we get. Currently, we are in phase 2 and 3. So that's what I'm going to talk here. So in phase 2, we have the data collection. So from the Health Informatics Department of Middlemore Hospital, we get all of these data sets. I don't know if you can see thank you. All of these data sets, and we are going to use all this information to try to predict dementia. This information is already collected, and the idea is just join all that information and do the work. The challenge here is, as I told before, some data are cross-sectional, some data are longitudinal. We have a lot of missing data. It's limits, but the idea is try to use it. To do that, to be ready, because we are in the process to get all the county, the Middlemore Hospital data, we ask for a subsample of 200 patients from the memory service, and we ask from that data from the whole hospital to see how the data is, to start to thinking about all the codes, thinking about the pre-processing, thinking about what another data we could get. And one of the biggest problems that we're facing is like the memory service. I mean, the memory service make the diagnosis of dementia. They have, I think it's every week they meet and they make a diagnosis, looking each patient for patient, and all the multidisciplinary people make that decision. But not all the people in Middlemore Hospital has a diagnosis. Even though that we know that there are more people with dementia, they don't have literally the diagnosis of dementia. So for teach to the model, to the machine learning model about dementia, we need to put in the data the labels that the people have dementia know. So that's a big problem. So how we can get that, how we can get the labels of dementia, no dementia, the idea is using these 3 data sets. So InterRAI data, because in InterRAI data, they have the screening of diagnosis of dementia. Pharmacy data, because people has been prescribed for anti-dementia drugs is because they have a diagnosis of dementia. And hospitalization data or discharging data, because if they have a code of ICD-10 code of dementia, it's because at least they have like dementia. So at least, it's like a red flag of dementia. So we are using these three data sets. If the person has at least in one of these 3 and like an indicator of dementia, we're going to label it as dementia. And then we are going to get all the data before that diagnosis, and that's the data that we are going to use. As we use data from the memory team, the memory service in Middlemore Hospital, we have the actual diagnosis of dementia. So we make a comparison between the actual diagnosis of dementia and the diagnosis using the routine collecting data. We found that the numbers are actually quite accurate. Maybe we have more here in the data of routine collecting data telling us that 26 people has dementia, and from the memory team, they don't, but probably it's because the data from memory team, I mean, the data that I got is a little bit an update. So probably that's why. But at least this is a good indicator that using routine collecting data could be a good ascertaining to the diagnosis. So moving forward to phase 3, the idea is using I call longitudinal data, but probably that's not the right definition, because longitudinal data in statistics is more that a panel following. This is just data that we have from the same people over the time, like for example, blood tests. So when you go have a blood test, you have a register. So there are people that have 100 registers. There are people that only have 2 registers. And we are using all the data with all the demographic, and I call it static data. And the idea is mix all that information, use a machine learning model that could join all that information, and at the end, we'd make a prediction of dementia before the diagnosis. So where are we now? Basically, we are waiting for the data. So the people in Middlemore Hospital are working really hard to give us all the data from people 65 and older, all the people that have been in the hospital, from information from 2013 and now until now. We are preparing as well the request form to get the InterRAI data. But to do that, we need to wait the data from Middlemore Hospital to know what is the people that information we need. I started to doing some experiments with machine learning models as well. That's the project so far. So very excited to see the results. Thank you very much.
We have time for one question if there's someone has a question. Yeah.
Thanks. That's a really fascinating project. I'm just curious of how you use the output from the model. So you're going to predict that someone is going to develop dementia. Will you inform the patient? Will you inform the doctor? What will you use the output of your model for?
But the idea of the model is the output is going to give me a risk. So it's that kind of probability in the time. So this is something that we are deciding because we have the diagnosis and the time before, so we can use the model to predict at that time or predict 3 months before, 6 months before, and 1 year before, depending of the data. But the idea is we get like kind of risk score, and that risk score could tell us, okay, if this person has a high risk, it's like a red light to, hey, we need to do something. I don't know if Isara, you can add anything else.
Yeah, I just want to add to that because it's a huge ethical issue, and we are not doing, it's all de-identified data, and we're just looking at whether it's possible at the moment. But at the same time, we're doing quite a lot of focus groups with service users about whether they would even want this to happen. I mean, it's the ethics around screening. You know, why would you screen for something that's currently not treatable? Some people would say, well, they'd rather know earlier than later. And if they knew really early, they might adjust their lifestyle risk factors. Who knows? But I mean, that is the other part of this study, that we really need to have those discussions with people because AI is coming. So we need to involve the public about whether they want to know these things or not. And dementia is also coming. So yeah, a really important question.